Are you struggling to stay focused while studying for embryology for your FCPS Part 1? If is it so, then this video is for you. Dr. MedMind had made it easy for you. 100 plus Rafi points of embryology are condensed into 2 pages of pictorial content. So let's get started. पहली जो पिक्चर है वो है थायराइड ग्लैंड के बारे में। थायराइड ग्लैंड के बारे में जो चीज़ें याद रखने वाली हैं वो ये है कि फोरामेन सीकर मार्क्स द फॉर्मेशन ऑफ which structure. So the answer is going to be thyroid. And relations about thyroid gland is medially related to recurrent laryngeal nerve and posterolaterally related to carotid artery. Another case-based scenario is a child presented with midline swelling below hyoid bone since 2 months after birth. The answer is going to be thyroglossal cyst, which is a midline swelling below the hyoid bone as shown in the image. Now let's move to the second image. Second image is about the ventral mesogastrium and the dorsal mesogastrium. जो इसमें बात याद रखनी है that is mesogastrium is the region of abdomen that is present between the epigastrium and the hypogastrium. You must know the derivatives of the ventral mesogastrium and the dorsal mesogastrium. The ventral mesogastrium derivatives are falciparum ligament, right and left triangular ligament, coronary ligament, hepatoduodenal, and lesser omentum. Where the derivatives of dorsal mesogastrium is gastrophrenic ligament, gastrosplenic ligament, lienorenal ligament, and greater omentum. Third image is about the embryology of the genital tract, particularly the derivatives of the Wolffian and the Mullerian duct. Mullerian duct is also known as paramesonephric duct and Wolffian duct is known as a mesonephric duct. So in the image, the blue one show the Wolffian duct, whereas the red one show the Mullerian duct. So now first see the derivatives of the Wolffian duct, that is a blue one. So male gonads are the derivatives, that is epididymis, ductus deferens, seminal vesicles, ejaculatory ducts. These all are the derivatives of the Wolffian duct, also known as mesonephric duct. Whereas the red one, that is the paramesonephric duct, that give rise to uterine tube, uterus, cervix, and heredity of Morgagni, and appendix testes. Now the fourth image is about the urogenital sinus. Urogenital sinus forms bladder, prostate, and urethra. And it is divided into upper and lower part by closa, that is shown in the image. Prostate marker release in sample taken from which structure? The answer is going to be the urogenital sinus. Trigone of the urinary bladder develops from the urogenital sinus. The fifth image is about the fetal circulation. इसके बारे में जो याद रखना है, that is about the human umbilical cord. That consists of 2 umbilical arteries and 1 umbilical vein. The vein carries the oxygenated blood, whereas the artery carries the deoxygenated blood. So oxygenate 80% of the oxygen saturation is present in the umbilical vein. Highest oxygen saturation is present in umbilical vein. Number of umbilical arteries are 2, at which week can Doppler ultrasound detect umbilical artery pulsation? The answer is going to be 7 weeks. जो अगली इमेज है दैट इज़ अ यूएस एमिली फेवरेट. द एम्ब्रियोनिक स्ट्रक्चर जो है जिसमें जेनिटल रिज है. जेनिटल रिज गिव राइज टू ओवरी इन फीमेल्स एंड टेस्टिस इन मेल्स, whereas genital swellings give rise to labia majora in females and scrotum in male, where genital folds they give rise to labia minora and ventral aspect of penis, where genital tubercle give rise to clitoris and glans penis in male. So this is important. The ridge, swelling, fold and tubercle they give rise to the different structures in male and female. सेवेंथ इमेज जो है वो है जर्म लेयर्स के बारे में. एंड देयर आर फ्यू जनरल रूल्स अबाउट द जर्म लेयर्स. ectoderm, endoderm, and the third is the mesoderm. So about ectoderm, everything that make you attractive, for example skin, hair, nail, breast, teeth, enamel, lens, cornea. The exocrine glands, sweat gland, sebaceous gland, mammary gland, lacrimal and parotid. And there are a few part of the nervous system. Neural crest of ectoderm, it gives rise to peripheral nervous system and adrenal medulla and melanocyte, whereas from neural tube of ectoderm, brain, spinal cord, posterior pituitary, anterior pituitary, they arise. Whereas endoderm is responsible for giving rise to the lining of the tube from nose, mouth, and ear to anus and urethra and vagina. Whereas the internal organ, pharynx, thyroid, parathyroid, trachea, liver, pancreas, they all are derived from the endoderm. The mnemonic to remember the derivatives of mesoderms is gonads, and G is for genitourinary, O is for others, and N is for notochord, A is for adrenal cortex, D is for dura mater, and S is for spleen. So these derivatives are very important. They are repeatedly asked. A number of MCQs are asked from this germ cell derivatives. The next image is about the thymus. For thymus, you need to remember that the thymus and the inferior parathyroid gland, they both are derived from the third brachial pouch, whereas the superior parathyroid is developed from the fourth brachial pouch. The next image is about the fetal postnatal derivatives. Ductus arteriosus, which is a fetal structure, it gives rise to ligamentum arteriosum, while ductus venosus give rise to ligamentum venosum. Foramen ovale give rise to fossa vallis, whereas allantois give the N in the allantois is going to show the median umbilical ligament. Umbilical arteries are going to show medial umbilical ligaments. Umbilical vein gave rise to ligamentum teres hepatis, that is also known as round ligament. Round ligament is derived from the umbilical round ligament is derived from the umbilical vein, and nucleus pulposus is derived from the notochord. 10th image is about the placental components. इसमें जो है placenta जो है it is developed from the chorion frondosum and the deciduum abyssalis. Fetal placenta is the chorion frondosum and are developed from the same blastocysts that form the fetus, and the maternal placenta developed from the maternal uterine tissue. The chorion frondosum, there is a fetal component. It has two parts, the cytotrophoblast and the syncytotrophoblast. The C for cytotrophoblast makes cells, and the syncytotrophoblast, S in syncytotrophoblast, synthesize and secrete hormones. The maternal component is the deciduum abyssalis that is derived from the endometrium. जो नेक्स्ट लास्ट टू इमेजेस हैं 11th एंड 12th इस पेज की, इसमें डिफरेंट कंडीशंस है प्लेसेंटा की. So in the 11th image उसमें placenta previa, placenta accreta, increta and percreta. Placenta accreta is when placenta get implanted in the myometrium, superficial aspect of myometrium, but without any deep invasion, as you can see in the image. That is accreta. और जो increta होता है, increta में it is get implanted deep into the myometrium, whereas percreta is when the placenta get implanted to the wall of the uterus. Placenta previa जो होता है, it is a condition when placenta attaches in the lower part of the uterus, that is covering the internal os, and is a classic cause of third trimester bleeding. And ectopic pregnancy is also the classic cause of bleeding in first trimester. So placenta previa is the cause of bleeding in third trimester, and the cause of bleeding in first semester is ectopic pregnancy. Now let's move to the page 2. Page 2 की जो पहली image है वो है Doppler की. That is umbilical artery Doppler. You must know when it is done. It is done as early as 7 to 8 weeks. 7 to 8 week visualization of blood flow in the umbilical cord. And the establishment of end diastolic flow is around week 14. Fetal movement start around 8 weeks, and fetal movement detected by mother at 20th weeks. So these are few terms that you must know. डॉपलर के बारे में ये है कि एज अर्ली एज 7 to 8 वीक्स हम डॉपलर कर सकते हैं, और एंडास्टोलिक फ्लो जो होता है वो वीक 14 में डेवलप होता है. Now let's move to the second image, that is about erythropoiesis. Erythropoiesis जो होता है वो, regarding fetal erythropoiesis, you must know that in embryonic life it occurs in the yolk sac, and in the middle trimester pregnancy it occurs in the spleen and liver and lymph nodes. Early fetal life, in early fetal life or in middle trimester pregnancy it occurs in spleen, liver and lymph nodes. Later on in life and in later in fetal life in early childhood until age of 5 years, the erythropoiesis is happening in the red part of the bone marrow. The marrow of the long bones, except for the proximal portion of the humerus and tibia, become fatty, and they produce no more RBCs after 20 years. So you must know about this, the erythropoiesis. This is from the book Guyton. Now let's move to the next image. That is the third image. That is about the ureteric bird. About ureteric bird, you must know that it arises from the lower end of the mesonephric duct, and it gives rise to the ureter, the pelvis, the major calyces, minor calyces, and collecting tubules. And fourth image is about germ cells. Germ cells के बारे में जो याद रखना है कि it is the other type of cells that have the most telomerase activity. Primordial germ cells जो होते हैं वो ectoderm से derive होते हैं, and germ cell arise in yolk sac at third week of intrauterine life. Primordial germ cells are derived from epiblast, and epiblast as primitive ectoderm, hence ectoderm can be a choice as answer if epiblast was not among the options. So it could be ectoderm or the epiblast. Now let's move to the fifth image. The fifth image is about the mid-gut herniation rotation. So the mid-gut development start at the 6th week. There is a physiological herniation around the 6th week, and the mid-gut rotate by 90 degrees around the axis and axis of the superior mesenteric artery and vitelline duct. And at the 10th week, the herniated intestine loop return to abdominal cavity. The mid-gut loop rotate counterclockwise by an additional 180 degrees, thus making rotation of loop through a total of 270 degrees counterclockwise. Now the seventh image, that is about the Radke's pouch. Radke's pouch developed from stomodium of the foregut. The interior pituitary is adenohypophysis that developed from the Radke's pouch, which is an ectodermal derivative of the primitive mouth cavity. So stomodium is Radke's pouch developed from stomodium of the foregut. So if both options are given, you have to choose the outpouching from stomodium rather than the Radke's pouch. The development of the anterior pituitary gland is from the outpouching from stomodium rather than the Radke's pouch. Next image is about the derivative of the pharyngeal arches. So the mnemonic to remember, the derivative of first arch is maximal, and that is the maxillar artery, muscles of mastication, tensivilli penitentiae, meloid muscle, anterior baleo, digastric, mandibular branch of trigeminal nerve, and maxillary branch of trigeminal nerve. The second arch, the keyword is S. So the things you need to remember is stapedius, stellohyoid muscle, the posterior belly of digastric, and the stapedial artery, stellohyoid ligament, and the facial nerve. The third word, the mnemonic is pharynx, glossopharyngeal nerve, and the third letter of alphabet is C. So third arch is going to give rise to the structures that arise from C, internal carotid artery, common carotid artery, and stylopharyngeus. The fourth arch is the vagus nerve, and the vagus nerve, a fourth arch gives rise to the superior laryngeal branch of the vagus nerve. Laryngeal branch of the vagus nerve, and it also gives rise to thyroid cartilages, cricoid cartilages, and arytenoid cartilages. So these are the derivatives. The last image is about follicles. So the important thing about follicles is that oocyte with flat epithelium is primordial follicles, and the primary oocyte complete their first meiotic division before ovulation, and the oocyte release during ovulation is called the secondary oocyte. So you must remember about the primary and the secondary oocyte, and the oocyte which is with the flat epithelium is primordial follicle. अब ये जो सारी एम्ब्रियोलॉजी थी, ये सारी वो एम्ब्रियोलॉजी है दैट इज डिस्कस्ड इन द रफी पॉइंट. उसी को पिक्टोरियल प्रेजेंटेशन के थ्रू आई हैव एक्सप्लेन. आई होप everyone who is studying for fcps part 1 exam understood it and it was useful for everyone. Send us an email to get a PDF guide.